All smiles, the latest trend in plastic surgery has celebrities lining up for a softer, fuller look. That's right, sweet potato pie, friend. All right, thanks so much. There's a new trend in plastic surgery. The current issue of New York Magazine discusses a subtle shift, well, maybe not so subtle shift, from a face that is tight and taut to a face that is plumper and more youthful. CBS News correspondent Michelle Gielan reports.
For some, the face of celebrity is something to study, to admire, to emulate. And under the constant glare of the spotlight, many of these famous faces have had some serious help in softening that glare. Classic cosmetic surgery involved procedures like lifts and tucks that tighten the face. One obvious example, comedian Joan Rivers. Even she pokes fun at the work she's had done.
This face has seen more knives than a Benihana.
Cher and Faye Dunaway are other stars who famously tightened up. The trend these days among Hollywood's aging elite, a softer, fuller, and hopefully more youthful look. The idea, instead of tightening the face, add volume to it through the use of surgery or injectable fillers.
I think celebrities now are sculpting their faces more with fillers to give them that more attractive, youthful appearance that they had when they were younger.
Take, for instance, Demi Moore. This photo was shot in 1996. Look at her now. This photo of Madonna is from 1986. 22 years later, it looks like she hasn't aged a day. And finally, check out Michelle Pfeiffer in 1990. Here's her today. Most of these celebrities won't admit they've had work done, but it seems like more than the years have been kind. For The Early Show, Michelle Gielan, CBS News, New York.
And joining us to talk more about it is Dr. Derek Antel, a plastic surgeon. Good morning.
Good morning.
Really is a stark contrast to what we used to think about plastic surgery, that taut. I mean, they were trying to stretch it. You wondered if people had buns on the back of their heads because the skin was so taut. What's going on now? What is the biggest difference?
I think, Harry, today we realize that volume is an important component. It's not just about lifting, and a two-pronged approach is the best way to do it. We combine fillers with a lifting procedure.
So there is an actual surgical procedure with lifting, but then it's what's the added ingredient?
Well, fillers will help replace volume, and they're often a good thing to do early on. But we've seen a 14% increase in facelifts in the last year. That's huge.
That's
14%.
amazing. Well, it's because I thought it was going out of vogue, but it's still there's still the surgery. Show me now. There's a picture behind it. Is this anybody we know?
Well, the most important part of getting a good result from plastic surgery is the surgeon that you choose.
Okay.
This lady chose the right surgeon.
It must have been you.
Now, she's a composite, but if you look at this lady, let's start at the top.
Right.
Her forehead is very smooth. Her eyebrows are in a great position. Her eyes don't have extra skin on the upper or the lower lid. There's no puffiness.
Right.
It's more about fullness. She has full cheeks. She looks juicy, if I were to pick one term.
Interesting, because in the old sort of model from a couple of years ago, Botox the forehead, it looks flat. There was no, you couldn't tell if a person was smiling or not.
Well, we want to maintain their identity. I think that plastic surgery should whisper and not scream, and that's really what it's about.
Right.
You want to look better, not different.
Right. And what are you putting in people's faces along with the surgery? What's actually the filler?
Well, one of the most common fillers we use is fat injections. Your own fat. You can't be allergic to it. There are also some off-the-shelf products that are available as an office procedure with virtually no downtime or recovery.
Very interesting stuff. Dr. Derek Antel, thank you very, very much.
Thank you.
Do appreciate it. Now here's